Hello and welcome to Transforming Healthcare People Behind the Progress, a series from HSE Technology and Transformation. My name is Helena Murphy and today I'm joined by Joyce Shaw, Chief of Staff and Head of Business Operations, as she prepares to retire from the HSE after many years of public service. Joyce has played a central role in supporting leadership, business operations, recruitment and organisational change across technology and transformation. Today is a chance to reflect on that journey, the progress made, and the work that helped build the foundations for digital for care. Hello Joyce, and thank you for joining us today. As we take a look back on your time in the HSE, what stands out most to you when you look back on your career in the health service?
Oh gosh, that's a tough one in a way. What stands out? A lot, really. If I think back over the years, I guess what really stands out is probably the whole evolution cycle of business operations, where we started and where we are today. And now we have a significant division delivering what I would feel is a real significant service to the T&T family and the entire digital family really. And I mean, there's a work stream within business operations that delivers out to the entire HSE, and that's the mobile telephony team. We've come from somewhere where, you know, we had pockets of admin across the country, probably really in the former health board setup. And we were seen not really a part of the whole IT delivery. It was just that little pockets of admin support, to becoming a division that's really considered key to support the delivery of these big programs of work within the whole digital for care and across ICT, from those foundational pieces of which we are one, to the whole workforce support piece. So the evolution is significant, and it's something that I look back on and feel very proud to have been a part of. And a part of, I'm particularly saying, because it isn't down to me. Nothing is ever achieved in isolation, so it's a real team effort.
Joyce, when you first took on responsibilities for business operations and later the wider Chief of Staff role, what were your key priorities at that point and how did they evolve over time?
It was really to build up, as the department grew, the ask of us grew really. So it wasn't something even that you kind of think of in a moment. It was just something that grew and evolved, and the asks were becoming more and more of our department. And the brief broadened really. So it didn't become, we probably moved from what was considered a business administrative type support unit to a much broader holistic workforce support brief, from, you know, the financial piece, which we would have always been a key part of. And of course, look, that has grown exponentially. I mean, our financial capital and revenue remit is significant. I mean, we're a huge IT business now. To the evolving piece for, as I referenced earlier, in that mobile telephony piece, where we are supporting the mobile telephony requirements of the entirety of the HSE, which is huge. We're the biggest employer in the country, really. Across, you know, the HR piece, which has really grown a lot over time. And that's evolved, and even from recruiting through National Recruitment Service to, you know, becoming a trusted partner with National HR, so that we had, you know, the delegated authority to run all of these recruitment campaigns ourselves, to the onboarding piece. And again, you know, there's a work stream there now who ensures that when you start and you get a job in T&T, you're literally ready to go on day one. You have your accounts, you have your kit, you have your desk, you know what you're doing, you know you've had an engagement with your line manager. I mean, back in the day, you could walk into an office and you'd be sitting and you wouldn't know. You know, you could be waiting a couple of weeks before you're even able to get set up. So that's something I'm particularly proud of as well. And then the whole HR, the learning, engagement and development piece, and that really has grown a lot over the years. I mean, we've onboarded so many people in the last number of years through recruitment, and now we're invested in their future and their careers really, and we provide significant support there. And then there's all of the whole ER piece, you know, and every action that's, you know, involved in your career to do with your payroll, to do with anything, a move of base, anything that changes your terms and conditions, we're involved with all of that. And when we have up on nearly 1,500 or whatever in the broader community plus, you know, there's a lot of work going in there to support that, the entirety of that workforce.
You've worked with many people across the HSE and within technology and transformation. What have you learned from the people you've worked with, and what or who has stayed with you over the years?
Yeah, well, it's dangerous territory here now if I go and start naming people, because I'll surely forget somebody, and I don't want to do that, because I've worked with some amazing people over the years, and I've been really, really lucky actually. And I would credit, you know, a number of people, and you know, a lot of them are in my mind, but a number of people who trusted me to do what I needed to do, you know, and I think that's really important, because if we stifle people who work to us, we're not going to allow people develop in their own right, you know. And I've been really lucky, and I've had people, you know, line managers, leaders in this organisation who've been really, really supportive of me, who I wouldn't have been able to create, and we wouldn't have what we have now in business operations without those people. You know, and look, we all make mistakes as we go, so you can't operate in a fear environment either, or that kind of a controlling space. So I would say that has been a key learning for me over the years, and I certainly would hope that I have in turn been that type of manager, leader, whatever we want to call ourselves, and would have created that culture within the division of business operations, and that translates through people down through the ranks, you know. And the whole thing, I'm always talking about succession planning. I don't know if everybody's always listening to me, but I think that's a big part of building that, and building the competency and capacity within the teams. You know, you have to allow people the freedom to make decisions, to make mistakes, and support them in the good times and the not so good. You know, and I have been really, really lucky where I have had people who have invested that trust in me. So yeah, there are a lot of people, and I'm not mentioning them, but I think they probably know who they are. I've probably thanked people over the years for the support they've given me.
When you look back on your time in technology and transformation, what are you most proud to have helped build, strengthen or put in place?
I feel I'm lucky, and I've been in a privileged position within technology and transformation and Office of the CIO and eHealth and all the iterations of it. I've been around a while. And I've been in a position where I have been able to, you know, affect even the careers and the development of individuals. I've been lucky enough to be involved in bringing on some fabulous talent into the workforce. I mean, Ben is our videographer here this morning, and he comes in and, you know, Helena, we've spent money on professionals to come in and do jobs which we've looked at and they're terrible. And we have a cohort of young, really talented people who do all that work now with us. And we've done it for other divisions in the HSE with huge success. So, you know, I've been very lucky, really, over the years as part of that, you know, chief of staff role, and even I guess the part where you're around a while, so people know you, you've built relationships, you have those connections, and people trust you. And I do believe we've built that HR support piece, which is key, where people now will reach out and ask for help. And oftentimes, you know, you can head off what could be a potential issue at the pass, or you can, have a couple of conversations that will dilute something that could become more, which isn't to the benefit of anybody. That's the last thing anybody wants. I've been very proud of what we're able to do, and that supportive culture that we've built, and people know they can dip in when they need to, sometimes at low points, and we all need help every now and again, and I think we've created that environment where people are comfortable to do that. And I think the fact that it's in-house as well, it's not that National HR don't do a fantastic job, don't get me wrong, but I think it's seen as it's our own people, our own team, so people are more likely to reach in. But there's a lot of things I'm very proud of, and as I say, I've been very privileged, and I have been able to do a lot of work on interview boards, do a lot of work with people to try and help them get on in their careers, and we've a fantastic talent and learning division under Thelma there to support people in their career hopes. So yeah, there's a lot to be proud of, really. Gosh, when I look back and I think of all the things we're doing, really, it's a lot for all of us to be proud of. And I'm going to say it again, I might have been, heading up a division, but gosh, I'm often amazed and overwhelmed by the talent that's there. And I do say sometimes, gosh, you make me look good. And it's a fact. I mean, this series alone, what you're doing, Helena, I'm here talking or whatever, but we've interviewed some fantastic people, and we have the minister's interview coming up now in July. I mean, who would have even thought we'd be promoting what's happening, and that whole span of the digital for care, which we're trying to promote, and a new way of, implementing programs. Like we're doing a lot of really amazing things.
As we know, Digital for Care has a set clear direction for the future of digital health in the HSE. From your perspective, Joyce, what does it take across people, planning and delivery to turn that strategy into something real?
It's all about the people, really. We'll achieve nothing without those, and they're our key strength. When we look at Digital for Care, it's created a change in how we approach even program delivery. It's not about digital anymore. Yes, for sure, it's digitally enabled, but what we should be looking at, the premise is that it's service-driven and clinically led. That's like the tagline, isn't it? Service-driven, clinically led and digitally enabled. But it's about the people. It's not about the IT project. It's not about the system. It's about how we can support the patient, the care deliverers, clinicians, our colleagues in the service. That's the whole reason for these digital programs. It's to support the delivery of care. And in that, we have to look at how we do this differently. And now we would have multidisciplinary teams where we have that the clinical input, we have the digital input, we have engagements with the services, depending, and it's that's driven by the service, and it's not so much looked on as an IT project anymore. And in fact, it's clear to everybody involved that wouldn't be the way to go. And the ultimate is to, improve the care for the patient. We're all going to be patients if we haven't been already, and we have members of our family who could be in the system in some place, and it's to improve that. It's to allow the clinicians to do their job more effectively and efficiently. But it's a big task. We're coming from probably a lowish bar, but we're making progress. There's a lot of big programs being delivered at the moment. We have the Medalist program, we have the Shared Care Record, we have the Maternal and Newborn winning awards out there. There's amazing work ongoing, and the idea is that this will all roll up into, with the health app, this will all roll up into what we will ultimately have, a One Health record. That's a bit of a journey ahead of us, and it certainly isn't going to be easy. But look, there's a roadmap there now, and we're well on our way. We're a year plus into it. So, all I can say at this point in time is best to look to everybody with it, as I duck out. But I do believe the investment in the people is key, you know, and when you do that right, you get it back tenfold.
As you end your career, Joyce, would you have any advice for people starting out in new leadership or management roles within technology and transformation?
I would be very positive for anybody coming in at any level, really, to work in technology and transformation. I think there are huge opportunities there. I think there are opportunities to do some really key, valuable work, work that we can be very, very proud of. You know, often over the years when you interview people, and especially even during and after the COVID era, a lot of people chose to change career paths, you know, where they would have worked in corporate for the bottom line of some unknown global person out there to be making a lot of money and wanting to contribute a little bit differently, obviously getting paid to do it. But you know, we're one of the largest organizations in the country. Like sometimes you know, we forget that. You know, we as you know, we talk a lot about going to career fairs, going into colleges. You know, we have relationships now building with the likes of DKIT, and as it is aligned with Queen's University now, and we're working with the National College of Ireland. We've done a lot of work previously with TUD, you know, and these are key because we want to attract people into the workforce. And I sometimes think maybe we should even be going into schools, because like there is significant opportunities for fantastic careers in the HSE, the broader HSE. But I mean, even if you look at our teams now, they're not just made up of technology people or business people. You know, we, as I said earlier, we have the multidisciplinary element to it now. But you know, I would encourage anybody into T&T. I think there's great opportunities. You know, I wouldn't see it as a bad option as a career. So I would be very encouraging if somebody were to ask me my opinion anyway on choosing the HSE in the public sector as a career opportunity.
As you retire, Joyce, what would you most like people to remember about your leadership and the way you approached your work and the people that you worked with?
You know, we all want people to think well of us, don't we? It's human nature at the end of the day. I'd like to think I would have been a positive role model for people who would be coming up within business operations particularly, but anywhere really. I mentioned earlier, I think it's important to realise that we don't achieve anything on our own, that you have to embrace other people's strengths, abilities, ideas, and you have to be prepared for that not to work out. And that no one person knows everything, and you're not right all of the time. And you can, I don't know, laugh at yourself sometimes and just, you know, try your best to do the right thing and to treat people really, I know it's cliche, treat people how you would want them to treat you. But I think, you know, that wouldn't be a bad lesson or a bad thing to live by and work by, really. And you won't go wrong. Sometimes it's difficult, you know, we want to be empathetic, but at the end of the day, like, you have to deliver as well. We're all here, we're getting paid to do a job. So sometimes the balance is difficult, you know, and you just have to do your best. And you won't always get it right, and that's okay too. And it's okay to say, put your hands up and say, gosh, that wasn't the right thing to do, or I'm sorry, shouldn't have maybe said that, or whatever, you know. But to do your best. And as I say, I hope people will smile and think of me in a nice way. Anyway, I hope that the culture is strong, having been part of it. I feel it is, and I'm sure it will continue in that way.
Can I ask, Joyce, what, if anything, will you miss from your time working in technology and transformation?
What will I miss? Well, I mean, again, cliche maybe, but I'll miss the people. You know, you can't but have relationships with people when you're around so long, and you work with people very closely for a number of years. So yeah, I mean, you know, we often say, oh, we'll keep in touch, we'll keep in touch. It's a very difficult thing to do. You know, people's lives move on. You move away from the work element of it, and people are very busy doing what they need to do. So it's difficult. But I suppose that takes a little bit of effort. But I will miss the people. I've worked with fantastic people I would consider friends now. And it's an exciting time in technology and transformation, you know, where we are delivering on that whole program of work, digital for care. So there's exciting times ahead, I think. But I'll be sitting in the wings, hopefully, you know, cheering everybody else on, and everything will be going well towards, as we say, the One Health record in the Dublin North East region as Region 1. So yeah, in a few years' time, hopefully that's what'll happen.
Have you any words, Joyce, you'd like to share with your team leads and colleagues in business operations and the wider T&T as you leave?
Well, first of all, you know, nothing's going to fall over when I go. I know that for a fact. Like, everybody who's, you know, the team leads, the teams in the 5 work streams across business operations are more than capable of running that division. I know that hand on heart, without a doubt. So look, everything's going to be fine. The future is safe. I do believe that. And I guess I'll take a little bit of pride in that, because, you know, we've worked our way up through the ranks over the years. So that's really good. But look, I'd have to say that I owe a debt of thanks really to everybody, because I alluded to it earlier. You know, we've been very successful in what we've delivered. We're all, I'm sure, not just me, very proud of what we've achieved over the years and the division we are now, and currently, you know, priming ourselves for that next phase of workforce support and planning around that. And I've been lucky to be acknowledged over the years, you know, as the head of business operations or as chief of staff, whatever I'm called. But really it's on the back of a lot of effort from a lot of people. So, you know, I want to say that very, very clearly. It's been a team effort, and it's something I'm very grateful for and I'm very, very proud of.
Joyce, thank you for joining us today, and thank you for everything that you have contributed to over the years to the HSE and to technology and transformation.
Thank you, Helena.
Thank you for watching. To keep up to date on the people and programmes helping to drive digital for care across the HSE, follow HSE Technology and Transformation on our social media channels.